Hello, this is Siddharth Amber from Chicago Arthritis and Regenerative Medicine. This is April 22nd, 2020. I want to give an update in terms of how we are trying to protect patients who need to come into the clinic over the next month or so. So number one, we are extremely low volume in the clinic at this time. We've purposely pushed everything that we can to telemedicine, whether that's follow-ups or new evaluations and handling all of the medical and client service issues in that regard. So right off the bat, just by reducing the amount of foot traffic in clinic, we've been able to reduce, I think, the risk of minimizing the risk of Covid-19 in the clinic. Number two, we're doing the same thing with all of the team members in my office as well. And that means really limiting our time in the office at this time to just twice per week. As time goes on, we'll slowly start to increase that, but we're going to do so in a safe way, which I'd like to describe. So first and foremost, of course, we're complying with all the basic medical guidelines. Cleaning surfaces obsessively, wearing masks, washing our hands obsessively. Those are things that we do anyway, and now we've added on the mask requirement as well. But those are things that we're already on top of and that every medical clinic should be doing regardless. In addition, some other things that we're doing. So we are planning on getting a COVID-19 antibody test, hopefully one that has been properly vetted. There's a bunch of tests out there that have not been fully vetted, and we're trying to get one that is properly vetted that gives us more reliability. The goal is to have something that can help to test all of us in the clinic and any patients that need to come into the office as well. So some details. When we have these kits, and we're hoping to have them by next week, we'll be able to test everyone in the office, my entire team and myself, once per week to make sure that we are okay and low risk. There are some potential downsides to these tests, including possible false negatives. That means someone who's actually been exposed can come back as a negative test. That's unfortunate with all of these tests that are out there right now. We are trying to combat that by not only testing people frequently, that means testing me and my staff every single week. It also means doing temperature checks every single day that we're in the office and just screening for other symptoms as well. Trying to be on top of that to the best of our abilities. In addition, for patients that need to come in the clinic, our plan is to start testing patients before they're actually allowed into the office by doing that kind of antibody testing, by screening them for symptoms as well, temperature as well. All of these procedures and requirements are things that we are trying to take into account, not only patient safety, staff safety, but the reality, which is that the testing is not perfect. We're trying to do the best that we can with what's available by utilizing diligence, focus, and trying to get the best testing kits that are available out there. Lastly, understand that if you're scheduled for any kind of treatment in my office and I am actually sick, understand that we do have contingencies for that as well. Whether that's if you're coming in for an actual injection procedure, a colleague of mine will be able to assist and take that over. You may need to have your actual treatment rescheduled based on that, but we do have a backup in that case. In addition, if you need an infusion treatment, we do still have the infusion nurse on hand, and we do also have Miss Leah Brown, my physician assistant, who is able to supervise and help take care of you if I am out as well. At this stage, I am healthy, taking care of myself, and I'm okay. But understand that we do have contingencies in that regard as well. We're thinking of you. We're thinking of how to protect you. We're thinking of how to protect my entire team as well. These are challenging circumstances and times, but we're trying to do everything professionally, ethically, and correctly to make sure that we all get through this in a safe and healthy manner. Any questions, call, email, or text at any time. We're here to help and assist you. Thank you for your time. Have a good day and live well. Bye-bye.